Good evening. My name is Dr. Craig Silberstein. I'm with Family Chiropractic Works. Been owner and operator of this business now 20 years. I had two new patients come in today, both of which complained of the same exact problem, and I want to discuss it with you very quickly. Both came in fairly athletic men, pretty good shape, and they had a very particular problem. They said, "Doc, my lower back has been killing me, and it's a lot worse when I try to transition from a seated position to standing." So in other words, I hope you can see, if they're sitting like so, it's a very distinct pattern. They go to get up and it feels like they get to about right here and then all right, so again, let me demonstrate. They go to get up and then it feels like something gets stuck and they have to use their arms to get themselves back up to straight. Once they're standing straight, they take a couple breaths and they can slowly start moving, and then the pain starts dissipating away. Now, I know I'm making this video because I know a lot of people out there have the same exact problem. I've seen it in men, I've seen it in women, have not seen it in children yet, but it's particularly common in men. It's a long explanation as to what causes this, okay? I'll give you a couple of quick examples. If you reach for something and you go to lift it up and bring it to you, the motion of forward carriage of the body, what it does to the lower back is it causes a significant strain on the lowest bone in your back. This is L5 right here. Now L5 has to ride on top of sacrum with these little joints. When you flex forward, the spine does this. All those joints open up. Now what winds up happening is when you go to correct and get back up, you overstrain by pulling something. The spine comes up, but L5 stays up. That leaves these joints open. I don't know if you can see that. I'm going to try and angle this so you can see. The joints stay more open rather than closing down like so, okay? Now because of that, it's a very distinct pattern. And every new patient that I see says the same exact thing. It's difficult for me to stand up straight. Now we do the x-rays and we send out for MRIs. I've never found any positive MRI findings with this particular situation. With x-rays, we find that the L5 is slightly tilted up. On some patients, I don't even see that. I can't measure it, but I already know it's there. Now here's the beauty of it. I can fix this problem in less than 3.5 minutes. I kid you not, less than 3.5 minutes, and I have about a 98% success rate. If it's this distinct problem. And again, you look back on the video, the patient will have difficulty transitioning from a seated position to standing. Now let me back up a little bit. The patient will be relatively comfortable seated. So they're going from maybe a 1 out of 10 pain, just a dull ache when they're seated, but when they go to get up, it feels like something just doesn't move right. They have to use arm strength to walk up their legs to get them upright, and then the pain between that. Okay, so just to recap, patient comes in, he says, "Doc, I have pain trying to stand up straight." We talked about what's causing it. It is a very quick, easy fix. I am really getting sick and tired of patients coming in after weeks and weeks and weeks of referrals. They come in with MRIs, CAT scans, they've gone through physical therapy. The physical therapists usually make them worse because they don't understand exactly what's happening. It is a mechanical problem with the articulation of L5 on sacrum. My name is Craig Silberstein. I'm a chiropractor here in Central Florida. I've been in practice 20 years. Like I said, 3 to 4 minutes, we fix this. The patients are seated, getting up, seated, getting up, seated, getting up. All day long, the pain's gone. Have a great night. I hope this helps you guys.